Hello and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. Before we get started, I had two things I wanted to tell you about. Number one, definitely go check out the Downsized channel. I just did an interview over there with Christopher and Lorraine, and they are absolutely delightful. Their channel is just like abundant in information on the latest news. Plus, they do a really lovely job documenting their own journey on GLP-1 medication. So you can really see the ups and downs and everything they've been going through. And they're really just so open and willing to share information about their experience. So I highly recommend that you go check out the interview, subscribe to their channel, and you will be very happy that you did. And number two, you may have heard about orforglipron, which is an oral GLP-1 medication that Eli Lilly is making. They just completed one of their phase 3 trials, and there are some promising results in terms of weight loss. And that trial was really more for diabetes, but this is a medication that could get approved or could be submitted for approval by the end of the year. And that would make it, if it does get approved by the FDA, the first oral weight medication that's a GLP-1 receptor agonist. So that would be really exciting. But I'll link the press release. The study hasn't been published yet in a journal, but I will link the press release and something for you all to check out. And then let's get started with the awesome questions. And as always, if you have a question afterwards, you can leave it on the video or on another video, and I will add it to the list. Also, I can't answer personal medical questions because I'm not your personal doctor, but if your question does lean a little bit personal, I'm going to change it so it's more broadly educationally relevant for everyone. And let's get started. I'd like to know if you can take your Zepbound injection every 2 weeks instead of every week. I'm currently on 5 milligram, and the 10 milligram dose is cheaper if I spread it out 2 weeks. That's a great question. So, if I had a patient who wanted to do that, this is one of those kind of like make it work type moments. If I had a patient and really the cost is prohibitive and it's a question of if they can't do this and they can't be on the medication, I'm usually going to try to find the best and safest way to keep them on the medication if they feel like this is a really good fit for them. So if I had the issues that would come up would be, I would be worried that they might not be getting the optimal results because half-life for tirzepatide is about 5 days. So, and let's say, they're tolerating the side effects okay. It's definitely something that I would be willing to entertain if it was really logistically an issue for somebody and this was going to really help save them money. Yeah, so there's still logistical issues with it. But in terms of would I be worried about safety in theory? Not really. I'd be worried more about as long as they can tolerate that higher dose and it's not too much for them. I would just be worried more about efficacy and how well that would work at helping them achieve the goal that we had for them. But it's definitely something if I had a patient like that and the cost was really an issue and it was between that and not being on it, definitely would be potentially okay with trying these things. Again, this is, a new field of medicine. So sometimes we're in the just like, let's make it work mode. And as long as everything is safe and effective as it can be. So that is a great question. Thank you so much for asking. This next, this is a 2-question question because I've gotten a lot of questions about this, but I'm going to read these 2 questions together. I've just started GLP-1 through Weight Watchers. Insurance won't cover Wegovy. or others for me because I'm on Medicare. I would get off Medicare if I could since I'm overall healthy, but that's not allowed. So I have no other choice unless I pay $1,600 at Walgreens for Wegovy, which my doctor was willing to prescribe. So since you say you're not on board with compounding, can you tell me what someone in my situation should do instead of using a compound pharmacy? And second question is, how could I get on these medications? I tried Ozempic and I did lose, but I moved from Texas to California and have no insurance as of now, and I want to get back on. Can anyone help? So this, again, great questions. I do have a lot of patients on Medicare, and weight medicine is really mostly for most people, it is not covered by Medicare. So sometimes they will approve it for sleep apnea, or if people have, they've had a history of stroke or heart attack, or they sometimes will approve it if there's other things going on. But if I have a patient and really there are no extenuating circumstances around their weight, for the most part, Medicare does not cover it. So this is where, and again, I am not sponsored at all, but I think it's a great option for people if they can do it, is the Zepbound vials through Eli Lilly Direct. So you're getting the actual medication. So the Zepbound vials, if you haven't heard of them, Eli Lilly has their own direct pharmacy, and with a prescription from your doctor, they will send you vials of the medication as opposed to the pens. And so when they do that, they're able to give it to people at a much lower cost. So it's between, I'm going to say, don't quote me directly, but it's like $350 to $500 a month, depending on the dose and depending on if you are subscribed and you're getting the medications regularly. That is a lot less than $1,600. So it's not like a $25 copay that your insurance might, provide, but it's not $1,600 either. So I do have a lot of patients on Medicare who do opt for that as an option. And so I would definitely check that out. And then there are other medications in terms of generic liraglutide that I will sometimes use for people, or oral medications plus generic liraglutide. So everybody's different, but those are some things that you can also talk to your physician about as potential options for you. Also, okay, this is a question about microdosing. You seem to not be pro microdosing, which I didn't really understand why. My feelings about microdosing are conflicted. And a lot of it is really theoretical because we just don't have the supply, nor do we have the costs down enough so that we can really prescribe these medications off label. I certainly, for the right patient, I would be open to microdosing if somebody had really significant addiction issues, or potentially as adjunct treatment for certain types of overeating conditions. That might be really helpful. I think microdosing or off-label use is sometimes used for people who might not meet they might have a normal or a slightly overweight BMI, but it's under 27 and they're using it for weight. And in those circumstances, I wouldn't, if we're just using it for weight, and again, this is theoretical because supply and cost are not anywhere near where they could be for this to really be an option for a lot of people. But if I had let's say I had somebody who had a BMI of 25, and we wanted to get their BMI, to 24 or 23. We felt like that was healthier. And you could get, the medication and potentially microdose it. Is this something I would do for somebody if I'm just treating them for weight? In all likelihood, not. Usually there's a lot of wiggle room in terms of other things that you could do with somebody in terms of lifestyle. If you're looking at, going from a BMI of 25 to 23. So that's really, I'm not saying I would never use it for that, especially if somebody had like medication-induced weight gain. So I guess my answer is it really depends on the patient and the circumstance. And again, this is really, right now, it's really a theoretical exercise. So I'm not opposed to microdosing. I just think that, like any of these medications, you have to be really careful. And I'm really opposed to like casual use of medication. I think sometimes when people talk about microdosing, there's this kind of casual attitude like, oh, you can just like go on a little bit of this and it'll get better, or like something, whatever you're trying to treat will get better. And I worry about that because these are prescription medications. They have side effects. There's a reason why they're not sold over the counter. So I am opposed to that. I'm opposed to casual GLP-1 use. Everything needs to be monitored regardless of the dose that you're at. So this is more of like an ongoing, evolving discussion. Not opposed to it for the right person. But that's a great question. Next question. I have been on 7.5 milligrams tirzepatide for 2 years with great success. I would like to lose 10 more pounds and considering upping my dose. What are your thoughts on research that says staying on a GLP longer than 1 year puts one at risk for certain cancers and health risks? Tell me the research that you're thinking of, because we have a lot of research that shows that when you get somebody's weight down, you are preventing a host of other complications, including joint pain, diabetes, several different types of cancers. There are so many different cancers that correlate with higher weight and obesity. So, heart attack, stroke, like there are so many things that we can prevent from potentially happening when we get somebody's weight down. Now, there is a black box warning on the GLP-1 medications because in some rodent studies, there was a question of, does this increase the risk of a very particular type of thyroid cancer called medullary thyroid carcinoma or multiple endocrine neoplasia type 2. Now, if you had a family history of that or a personal history of that, that is not going to be a good medication for you because of this possible risk. Also, I won't prescribe this medication, the GLP-1s, if somebody has like a thyroid nodule that they're getting worked up. Like if we're in the process of investigating something in their thyroid, like a mass or a cyst, and we don't know what it is yet, that's not the time that I'm going to start them on a GLP-1 medication. But if there are specific studies in question, please send them my way. But we do know that when we treat obesity, we really prevent a lot of very, very serious medical issues from happening or getting worse. And so for me, for the right person, the benefit usually far outweighs the risks. And of course, these medications do have risks as well. But we also know that if people go off of these medications, the weight tends to come back on, just like you wouldn't expect 6 months at the gym to last you for 5 years. We don't expect these medications, which have a limited, time span in the body. We don't expect them to, in general, keep working months and years after somebody stops them. Now, is there always the rare person that loses all their weight, goes off the medications, and never needs to start them again? That's going to happen very rarely. But in general, the data that we do have shows that the weight does tend to come back on when people stop the medication. So for me, for now, at the time of this filming, I'm always thinking about somebody being on a medication for life, and that if they're a good candidate, that the benefits far outweigh the risks of the medication. And that's always an ongoing discussion with the patient as well. So thank you so much for that great question. Send me studies if there are particular specific research questions that you are concerned about. But all medications have side effects, all medications have risks, and also not treating medical issues has side effects and risks as well. So these are great questions. If you have other questions, please leave them on this video or another video. I am doing daily office hours for April, so I am getting through as many questions as possible. Thank you so much for all these questions. If you want to work with me directly, you can. I will leave that info down below. I do work as a life coach, and I help people with the non-medical aspects of their weight loss as well, which is such a big part of weight loss in general. So I'll leave that info down below. If you're not subscribed to The Downsized, go follow them, subscribe to them. If you're not subscribed to my channel, subscribe. And thank you so much for watching, and please be well.